Standard antidepressants don't work for over 60% of people with depression. The integrative psychiatry strategies I'll discuss in this video solves that problem for many people. I'll share my integrative approach to treating major depressive disorder, covering basic lab testing, advanced lab testing, natural treatments for depression, and lastly, exercise, light therapy, and diet. There are timestamps for each part of this video, so feel free to skip around to any part. Some basic lab tests I consider first before doing more advanced lab tests are B12 and folate, also known as B9, are essential vitamins that can lead to depression if they are low due to their role in making neurotransmitters. While repleting low levels is essential, did you know that even normal B12 and folate levels can still mean you have a deficiency within the brain? The reason why is because blood B12 and folate levels do not always reflect the B12 and folate levels within the central nervous system and the brain. For example, blood folate lab tests pick up both folic acid and methylfolate within the blood, and only methylfolate crosses the blood-brain barrier. Anemia can worsen fatigue and contribute to depression. This is checked with a complete blood count looking at red blood cells, hemoglobin, and hematocrit. Hypothyroidism, or low thyroid, is commonly associated with depression, making it essential to check thyroid levels. Low vitamin D is linked to depression due to its role in brain function, inflammation control, and hormone synthesis. High homocysteine can help identify a hidden B12 or folate deficiency. Low testosterone can cause a depression. If you are having depression together with lots of fatigue and sexual dysfunction like low sex drive, difficulty with orgasm, low arousal, those symptoms together would make me even more suspicious for a testosterone deficiency. Cholesterol is vital for brain health. Low levels have been linked to increased suicide risk in those with depression. Checking iron levels, ferritin, and total iron binding capacity can also be helpful, as iron deficiency is associated with depression. BDNF levels, also known as brain-derived neurotrophic factor, are regulated by iron. BDNF can be thought of like brain fertilizer. It helps the neurons in the brain grow. When someone is depressed, their neurons shrink. Increased BDNF is the end result of what we want to happen with most psychiatric medications. A medication with the fastest increase in BDNF is ketamine. That may be one of the reasons why ketamine works so quickly for depression, as quickly as within a few days. High CRP levels mean you have a high amount of inflammation. CRP has been found to be consistently high in people with depression. High CRP levels have also shown to make selective serotonin reuptake inhibitors not work as well. Instead, people with high CRP respond better to medications that work mostly on norepinephrine, such as nortriptyline, a tricyclic antidepressant, or Wellbutrin, a dopamine and norepinephrine reuptake inhibitor. I also order a complete metabolic panel to look at your kidney function in case we need to use pharmaceutical-grade lithium carbonate, and because some psychiatric medicines are filtered out through the kidneys. I also look at liver function to obtain a baseline. Some psychiatric medicines also slightly increase liver enzymes when they are started or when a dose is increased, so that's why it's important to have a baseline. Beyond conventional tests, advanced testing can reveal more subtle imbalances that may contribute to depression. A hair mineral analysis test can uncover deficiencies in critical minerals like lithium, magnesium, and zinc, as well as the presence of toxic heavy metals. It's important to do a hair mineral analysis test instead of a blood test because these minerals cannot be accurately identified in the blood. For example, zinc and magnesium blood levels may come back completely normal, but on hair mineral analysis, which is more accurate, it may show a bad deficiency. Lithium blood levels are not helpful at all unless you are taking pharmaceutical-grade lithium carbonate, because lithium blood levels will come back as 0. Whereas lithium on a hair mineral analysis will give us an accurate lithium level, showing whether you are deficient or whether you have sufficient levels. High cryptopyrroles can indicate oxidative stress, zinc deficiency, and vitamin B6 deficiency. An organic acids test identifies gut dysbiosis, meaning the gut bacteria is out of balance, which is a factor that can impact brain function and mood through the gut-brain axis. This test looks at yeast overgrowth, candida overgrowth, and bad bacteria overgrowth such as Clostridia. Imbalanced omega-3 and omega-6 levels can contribute to inflammation and depression. The most common imbalance is too low of omega-3 and too high of omega-6. Most people in America do not eat enough foods with omega-3, such as fatty fish, but they eat lots of foods high in omega-6, such as seed oils. MTHFR deficiency is a genetic mutation that affects how you metabolize folic acid. People without this MTHFR enzyme are not able to properly convert folic acid into methylfolate. Folic acid is a synthetic, man-made form of folate that is commonly found in all of our foods. Folic acid does not cross the blood-brain barrier. Only methylfolate does. So if you do not have enough methylfolate, you will not be able to make neurotransmitters such as norepinephrine, dopamine, and serotonin, all of which are needed to improve mood. In addition to correcting deficiencies, next we'll cover several natural treatments that can improve depression. Rhodiola Rosea is a flower that is known as a natural adaptogen similar to ashwagandha. It's unclear exactly how rhodiola works, but it's thought to reduce negative bodily responses to stress by stabilizing the HPA axis, known as the hypothalamic pituitary axis. A 2022 review of 25 clinical trials, 13 of which were randomized controlled trials, showed rhodiola significantly improved mental performance, fatigue, and depression, and anxiety in mild to moderate cases. It worked as well as standard antidepressants, but with fewer side effects. In one study, showing about half the amount of side effects. However, these were small studies, and specifically for depression, there were really only 2 randomized controlled trials showing it helped for depression. And one of them did not show a statistically significant result, so more research is definitely needed. S-AdenosylMethionine, also known as SAMe, is a highly researched natural supplement that was shown in clinical trials to work just as well as a powerful class of antidepressants known as tricyclic antidepressants. It's made from an amino acid called methionine and works as a methyl donor. DNA methylation in the brain affects how genes work, helping the brain change, learn, and remember better. SAMe has over 50 clinical trials for depression, 17 being open label, 19 being double-blind randomized controlled trials, and 21 studies comparing SAMe to other antidepressants. It works for depression both by itself and as an augmentation strategy to traditional antidepressants. A 2019 meta-analysis for 33 randomized controlled trials showed a moderate effect for improvement in depression with an effect size of 0.39 to 0.6. with the higher doses producing the higher effect size. To put this in context, modern antidepressants have an effect size of around 0.3, which is a small effect size. A 2017 meta-analysis of 7 studies showed vitamin D supplementation improved depression, and a 2023 review of 20 randomized controlled trials showed positive results were associated with augmenting with vitamin D. Saffron is a Persian spice herb that has evidence showing it can work just as well as imipramine, a powerful tricyclic antidepressant, and fluoxetine, also known as Prozac, which is a selective serotonin reuptake inhibitor, or SSRI. A 2024 systematic review of 23 randomized controlled trials looked at saffron and a few other herbal medicines for depression. 15 of the randomized controlled trials in the review were on saffron. The authors concluded that saffron showed encouraging therapeutic benefits, reducing depression symptoms in a way that was on par with typical antidepressant drugs like imipramine and fluoxetine. These results suggest that saffron may be a viable alternative or adjunctive treatment option for individuals with depression. They also noted that saffron was well tolerated with only mild side effects that went away with time. It can be used by itself or in addition to an SSRI. Saffron also does not cause any sexual dysfunction or weight gain, unlike traditional antidepressants. A 2019 meta-analysis of Saffron for sexual dysfunction showed a large effect size on improving arousal, lubrication, and pain in women and erectile function in men, but it did not improve desire, satisfaction, or orgasm in women. Low B12 has been associated with depression for a long time now. Again, a more recent study, a 2023 meta-analysis of 56 studies in children, showed higher B12 intake was associated with a lower risk of depression. A 2022 meta-analysis of L-Methylfolate between 7.5 milligrams and 15 milligrams daily showed it worked as an augmenter to medications for major depressive disorder. If blood amino acid levels are low, supplementation can support neurotransmitter function. To understand why this works, it's important to understand the tryptophan metabolism pathway. Protein is eaten and then broken down by the body into an amino acid called tryptophan. Tryptophan then gets converted into 5-hydroxy-L-tryptophan, also known as 5-HTP. And 5-HTP is then converted into serotonin. So without all the proper amino acids and each step converting properly along the way, there's not going to be enough serotonin going around to keep mood stable. Low-dose nutritional lithium, also known as lithium orotate, might also be helpful in depression. It has long been known that pharmaceutical lithium carbonate works to boost antidepressant effects of medications, but lithium orotate has not been studied enough in depression. What is known is that higher levels of lithium in the drinking water in different areas of the world is associated with lower suicide rates and fewer hospitalizations. So if hair mineral analysis testing shows a lithium deficiency, supplementing with low-dose lithium orotate can significantly improve depression and is very unlikely to cause any bad side effects because the dose is so low. 5-HTP, or 5-hydroxytryptophan, is a precursor to serotonin that has been shown in several studies to work for improving depression. A 2020 meta-analysis showed a large effect size of 1.1 for 5-HTP supplementation for improving depression and showed a 65% remission rate with the supplement. Remission means the depression symptoms go away completely. Standard antidepressants, by comparison, only show about a 33% remission rate. That being said, the authors of the meta-analysis also said that the evidence base for 5-HTP in depression was not as strong because of the small sample sizes, fewer randomized controlled trials, and heterogeneity among the trials. Heterogeneity means the trials were all quite different, which makes it more difficult to draw conclusions from. So 5-HTP is a natural supplement that does have research supporting its use in depression, but the limited amount of evidence needs to be taken into account. DHEA is a hormone supplement that has meta-analysis supporting its benefit in depression. In fact, the Canadian Network for Mood and Anxiety Treatment Guidelines, in their 2023 updated guidelines, said there is modest evidence for DHEA helping major depressive disorder in recent meta-analysis, and they recommend it as third-line option. St. John's wort is a natural herb that has very strong evidence supporting its use for depression. The 2023 Canadian Network for Mood and Anxiety Treatment Guidelines recommends St. John's wort as a first-line treatment option because of the strong meta-analysis evidence of it working for depression. The recent meta-analysis they're talking about specifically is one that was done in 2021 and involved a review of 9 meta-analyses of randomized controlled trials looking at how well natural supplements worked for psychiatric conditions. St. John's wort showed significant reduction in depression symptoms with a moderate effect size of 0.49. It's important to remember that St. John's wort does not play nice with other medications, and it can cause significant interactions with other medicines. Next, we'll discuss one of the most powerful and free antidepressants, as well as light therapy and diet for depression. Aerobic exercise, also known as cardio, meaning something where you get your heart rate up real high and you start getting out of breath, has been shown in many different meta-analyses to be very helpful for depression. One example out of many includes a 2016 meta-analysis that reviewed 3 other meta-analyses of exercise for depression. They found an effect size of 0.28. For reference, the effect size of standard antidepressant medication is 0.3. So cardio basically works as well as standard antidepressant medication. Other studies have shown that moderate and vigorous intensity exercise might work better than light to moderate exercise for depression. So for example, playing basketball where you sprint back and forth all the time works better than walking around the block. Aerobic exercise has also been shown in a 2015 meta-analysis of 29 studies to increase levels of BDNF, also known as brain-derived neurotrophic factor, which you can think of as brain fertilizer. It's good for the brain and it helps it grow. When someone is depressed, the brain neurons stop growing and start shrinking instead. The study showed a moderate effect size of 0.46 at increasing BDNF with just one exercise session. There have also been studies showing that a few times a week of resistance training works to improve depression, but the research is not as strong as with aerobic exercise. Most people know that the winter months, where the days are short and the darkness persists for a lot longer throughout the day, can cause a form of depression known as seasonal affective disorder, SAD. But what most people probably don't know is that light therapy actually works for regular depression as well. A 2020 meta-analysis of 23 randomized controlled trials and with 1,120 people showed that light therapy significantly reduced depressive symptoms with a mild to moderate effect size. Next, let's focus on diet and weight. Did you know that obese people have a 55% increased risk of developing depression? So keeping body fat to a normal level, not too thin, not too heavy, is definitely optimal for mood. It's not exactly clear why obesity increases the risk of depression, but it may have something to do with decreased self-esteem, and also high amounts of adipose tissue or fat tissue increases inflammation in the body, and increased inflammation has been linked to depression as well. So for someone that is significantly overweight and depressed, an important area to focus on would be diet and exercise, and focusing on losing body fat to get to a more healthy range. Eating more fruits and vegetables was shown in a review of 3 meta-analyses to decrease the risk of depression. Eating more vegetables decreased the risk of developing depression by 9%, and eating more fruits decreased the risk by 15%. A 2023 meta-analysis on the Mediterranean diet and depression found that the Mediterranean diet decreases the risk of depression by 19%. A Mediterranean diet primarily consists of dairy, chicken, eggs, seafood, olive oil, vegetables, fruits, and whole grains.